I know something that I always heard in the past, which is not fun, but that I'm a medical mystery, because it's like they just couldn't take the time to figure out what was wrong. If you're not fitting into this nice little neat box, then you fall through the cracks.
A patient comes in and they have, this going on and this going on and this going on. This hurts, they're not feeling well over here. And then in direct primary care, you have the time to kind of piece all of these together and really think about it and solve the puzzle. And then we end up seeing things that are missed in the traditional practice.
Welcome, everyone, to the PAI podcast, the Patient Advocacy Initiative podcast. I'm your host, Dr. Asha. And today I'm really excited to have a wonderful physician with us, Dr. Sheena Coffey with Dr. Direct. It's a direct primary care practice, which we're going to get into today during the show. She's the daughter of 2 retired Marines, which is awesome. Thank you to them for their service. She started her undergrad degree at SUNY Brockport and finished at Florida Atlantic University. And she went to medical school at Campbell University right here in North Carolina and completed her residency at Harnett Health. I always like to try to get a fun fact, and one thing that she loves to do is paddleboarding. So welcome to the show, Dr. Sheena. I'm so glad to have you here, because this is such an important topic to really share with patients out there as to what direct primary care really is.
Yeah, well, thank you for having me. It's really great to see your face and have this conversation with you. I always enjoy talking with you, and thanks for having us on.
Thank you. Yeah, me as well. I love talking to you. So we're just going to get started with the basic question. What is direct primary care?
That's a big question, but I'll make it simple because we try to make it simple, and that's what it is. It's just healthcare made simple. We take out the middleman, which is the insurance company, and we contract directly with our patients. So our patients pay a low monthly fee, and then we take care of them. And it's kind of like joining a gym. You pay the monthly fee, and then you're a member. And so when they're a member of Dr. Direct, we take care of them. And because we take out that middleman, the insurance, that's a barrier to healthcare sometimes. It takes up a lot of time. It takes up a lot of resources. And so when that is removed, those resources and that time and that effort and money all goes back to the patients. So it's a way for patients to get really personalized care pretty inexpensively. It's accessible to a lot of patients.
Oh, I love that. So there are a couple of things that you said that I absolutely adore. One is healthcare made simple. And the personalized care and taking out that middleman. So that's what I do in my practice as well. And I think it's so important for patients to understand that it's a lot of times we're strapped by the third party that gets put into the mix. So can you get into a little bit more of the personalized care that you are able to provide, taking out that middleman?
Yeah. So in residency, just kind of doing the traditional insurance-based model type of care, you would have, 15 minutes per patient. And so sometimes one patient would show up late, one patient would show up on time, and then another patient would show up early. And then all of a sudden you have 3 patients in front of you, and you're trying to multitask and take care of all of them simultaneously. And we don't encounter that in direct primary care because each patient has 30 minutes to an hour with us. So you really get that face-to-face time, and we really get to know you. And that way, I think when you really get to know your patients, you can better care for them that way.
100%. So, as a patient, we're all patients in some fashion. And I think just even as a patient myself, I value that ability to have time to be heard.
Yeah.
So do you see that with a lot of your patients, that they feel like they're being heard?
Oh, absolutely. And I probe too. So if they're a little resistant to give some of that information, I do kind of dig a little bit, because once I get to know the whole person, what they like, what they don't like, what their fears are, what they love about life, what's stressing them, what's hurting, what's not hurting, what's going well. It just gives me that whole picture, and then I'm able to take care of the whole patient.
Oh, I love that. So my whole entire approach is holistic wellness, and that's exactly what you're describing here. So I love that. And I will tell you, the first time I met you, I felt the exact same way just about you in general as a person, that you really care. You care to learn about the person that's sitting in front of you. And I think that's really important to note that in direct primary care, you get that ability to build a relationship with your healthcare practitioner or your physician that's sitting right in front of you. And I know that I've experienced in the past doctors that are just sitting there typing, not really listening, not really answering any questions, not really probing. So I love the fact that you said that you probe, because a lot of times patients don't feel like they have the ability to be able to share information with their physicians. So I'm glad to hear that. So can you dive a little deeper into what types of things that you see in your practice? What kind of patients, like illnesses, chronic disease states, things like that?
Yeah. So, gosh, I see so much more here than I did in residency because you have the time. And when you start digging and you start putting all the pieces together, if a patient comes in and they have, this going on and this going on and this going on, this hurts, they're not feeling well over here. And then in direct primary care, you have the time to kind of piece all of these together and really think about it and solve the puzzle. And then we end up seeing things that I think were missed that are missed in the traditional practice where you only have 15 minutes. And so we see some pretty rare things here that we're able to kind of just conjure up by, having that time to put all those pieces together. But we also see, the regular things. So we take care of high blood pressure. We take care of cholesterol. We take care of families. I love, love, love taking care of families. So I'll take care of children and the parents and the grandparents, and just make sure that their physicals are being done, their immunizations are up to date, making sure that they're, staying ahead of the curve and preventing diseases too, rather than, I think a lot of times we end up kind of chasing the symptoms once diseases have already progressed because, patients just, they get kind of diverted in the traditional healthcare and they're not listened to. And so some things just go ignored by the healthcare system. And then they end up in these disease processes that are quite, far along in the process. And I really like to try to focus on prevention and kind of see that future before we end up in that future and try to steer my patients in a different path where they end up just being healthier and happier in life because they're healthier.
So I, again, loved everything that you just said. we have very similar thought patterns, which is why I wanted to have the show. But the prevention, I think this is such an important piece because you said so many things that I'm going to bring up. So the puzzle, right? So our health, our wellness journey, our health and well-being, it's a puzzle. And if we have missing pieces, missing holes, sometimes we fall through the cracks, particularly in the traditional healthcare system. And so what you're saying is in direct primary care that you actually fill in those missing pieces and you help patients really feel heard and understood. And you're more on the prevention side of things. So you're talking about well care, sick care, preventative care before they even get to the sick care. And so that is really important I want everybody to understand that this is, I feel like, the major value and difference between traditional healthcare and traditional practices as well versus direct primary care practices. So is that time that is taken, the prevention piece. I'm a big proponent of that, obviously, but I think that's such an important part for everybody to feel like they can actually prevent a lot of these things from happening. Or if you feel like, I know something that I always heard in the past, which is not fun, but that I'm a medical mystery because it's like they couldn't take the time to figure out what was wrong.
Mm-hmm.
Right.
Yeah.
And that's another way that people fall through the cracks is if you're not fitting into this nice little neat box, then you fall through the cracks. And what I'm hearing with direct primary care is that you actually it doesn't matter which box you fit in, you guys are going to work with them to figure out what is wrong and how to get them to good health and well-being. Is that?
Mm-hmm.
And
yeah, yeah, absolutely. Yeah. And I know, when you're when you only have 15 minutes with your doctor, and sometimes, you're allotted that 15 minutes, but sometimes it's just 5 in the traditional healthcare system, because you got to factor in, rooming the patients and documentations afterwards and during and all that stuff. So you might actually only get, 5 minutes face to face with that doctor. And so a lot of times the patients are restricted, and they can only come in and say this one, issue that they're having, like, my ear hurts, and that's the only thing they're allowed to talk about is their ear. Meanwhile, they've got wrist pain, they've got stomach pain, diarrhea, constipation, whatever it is, all these other things that they're not allowed to talk about. They're just allowed to talk about that ear pain, and then come back later and we'll talk about something else, and come back later and we'll talk about the other thing. But when you have that time to sit down with the patients and get all of those symptoms, then that allows you to kind of, piece it all together. And a lot of times with the patients, it's kind of funny because they'll come and see me for ear pain, and I'll be the one that says, hey, yeah, while you're here, let's get this done. Let's talk about that. Let's, it's time for your cholesterol. Let's go ahead and get that done. You want to do that today, And so I'm the one that's also, trying to encourage them to just lay it all on the table and let's get it all taken care of.
Yeah, no, I love that. And I do want to throw a little caveat in there about our traditional healthcare system. I take my hat off to every practitioner that's in that and doing that, because it is a massive strain and stress. So grateful to everybody that's trying to do anything that they can possibly do for us and our patients. But why we're here talking about this is there are other options. And that's what I want everybody to understand is whichever way you go, the whole purpose of this podcast is to know your options and become your own advocate for your own healthcare. And so this is what I really, truly excites me. And Dr. Sheena, I could literally talk to you all day long, which I think we have in the past, sitting at a coffee shop. And I would love to have you back on the show to discuss some other things in detail. But I really appreciate you bringing up what direct primary care is. So I like to usually end the episodes with, what is the one thing, if the patients didn't take anything else away from this entire thing, what is it about direct primary care that you would want patients to know?
Yeah. What is it about direct primary care? I think direct primary care it makes healthcare accessible. It makes it easy and convenient. It gives you time with your physician so that you can get to know them. And I think it's just a better way to practice medicine and to receive healthcare.
Love it. And then do you have just one thing for patients to understand about their own health and well-being that you'd love to share?
Yeah, absolutely. So I think that a lot of times I see people kind of chasing happiness. They just, this elusive, what is happiness? How do I get to it? How do I find it? And what I've seen over and over again is that sometimes if I encourage patients to instead shift their focus and focus on being healthy and how do I make my mind healthy? How do I make my body healthy? Then I find that happiness is this really nice little side effect of that health.
We're going to unpack that on another episode. Ladies, I appreciate you saying that. If there is anybody out there that is looking for a practice in the Raleigh, Durham, Chapel Hill area of North Carolina, this is the practice to go to. So how do they get in touch with you, Dr. Sheena?
Yeah, so our website is a great place to get that information. And so it's just drdirectmd.com.
Fantastic. We'll have all of this information in the show notes. And I totally appreciate you being on the show today and sharing all the information that you have. And I look forward to having you back on again in the near future.
Well, thank you. It's always a pleasure to talk with you. And I really appreciate what you're doing for all of these patients and sharing with them what their options are. And I think what you're doing is fantastic. So thanks for having me.
Thank you so much.